Prostate cancer is common in men in the U.S. Out of every 100 men, about 13 will get prostate cancer during their lifetime. And a blood test ordered by your primary care physician can help screen for it.
But there's conflicting advice about what's known as a PSA test. Recommendations for who should get screened have been in flux, and results are not always definitive.
In this Medical Mythbuster, reporter Viv Williams takes an in-depth look at why a PSA test is not perfect but could potentially save a life.
PSA stands for prostate-specific antigen. It's a protein made by the prostate gland that can be measured by a simple blood test called a PSA test.
Should I get a PSA test? Should I not get a PSA test? And I think that's at the heart of the confusion.
Doctors use the test to screen for prostate cancer because the disease can cause PSA levels to rise. Dr. Christopher Warlick, a urologist at the University of Minnesota, says other conditions that are not cancer can also make PSA numbers go up, including an enlarged prostate, which happens to men as they age, urinary retention, and inflammation. The Prostate Cancer Research website notes 3 out of 4 men with a raised PSA level will not have cancer.
Just because your PSA is elevated doesn't necessarily mean that you have cancer. And even if you do have cancer, it doesn't mean that it's one that's necessarily life-threatening.
Warlick says some prostate cancers are so slow growing that they may never cause any issues or require treatment. Plus, PSA tests sometimes result in false positives, which could lead to unnecessary biopsies or treatment. So, if a PSA test isn't perfect, why should men have it?
If you are harboring a prostate cancer that has the potential to be life-threatening, identifying it as early as possible through PSA testing is going to be your best opportunity to affect a cure.
The United States Preventative Services Task Force recommends men ages 55 to 69 who are not at increased risk of prostate cancer talk to their healthcare providers about whether or not to have PSA screening.
I do strongly advocate that people consider getting a PSA test in the right context, and this is really important.
Dr. Warlick says men who have a family history of prostate cancer, have had prostate cancer, or are of African American descent may be at increased risk of the disease and should have PSA tests.
We think that PSA testing helps us identify disease perhaps 6 to 10 years earlier in the natural history of the disease than we would have detected it otherwise.
What are normal PSA levels? Warlick says that depends on your age because levels raise as you get older. But generally, anything above 4 means there may be something going on, and depending on a man's risk factors and general health, further testing, such as an MRI or biopsy, may be warranted. So yes, PSA testing can be confusing, but
for some men it can be a lifesaver.
With this Medical Mythbuster, I'm Viv Williams.